So dental implants, lots of questions about the cost. So what affects the cost?
There's a lot of things that could affect the cost. I brought a sheet just to help me kind of keep everything ordered, but there's 9 main things that I think affect the cost of dental implants. All right. So first thing, there's a whole bunch of different implant companies, and the quality of implants is not all the same. So you might have one company that offers a better implant made out of a better material, and then some maybe not as good. So that definitely plays into the cost of it. Another thing is
how much are they for you, by the way, these dental implants?
Yeah. So how much do I pay for the?
Yes.
It depends on the situation that I use them for. But typically they're around, $150, $200 that I pay for them.
Okay.
So if I see an ad that says, hey, $1,000 for a dental implant, in my mind, I know that I'm getting a really good deal, a deal that not many other people get because of how many implants I place.
Because of the volume you do.
Yeah, exactly. So,
because I've heard implants could cost to the dentist up to $1,000, even more.
And that could be possible. There's a specialized kind of implant that costs $10,000.
Okay.
Right.
So that affects the cost.
It does affect the cost, right? But in addition, it's not just that, but it's what the dentist can do with the implant, right? So if somebody thinks that they're just going to get an implant for $1,000, let's say.
You see it on Google.
All the time, right?
So you don't like it?
Well, I think sometimes it's a little bit hard to take that serious from my position.
Like misleading, possibly a little bit?
A little bit misleading. Okay. Because in my mind, me placing implants all the time, I'm thinking, what are the other factors that we have to consider? How much bone is around it? Are they going to have to do any kind of like tissue augmentation or anything like that? And so if somebody's just saying, hey, my implants are $1,000, they're disregarding the patient and what the patient's situation is.
So if they're misleading about one thing, they might be misleading about other things.
Totally possible.
Okay, so the amount of surgery is one thing.
Yes.
The implant is another thing. What are other things?
The other thing is how many doctors are involved, right? If you go and one doctor can take care of everything, naturally the price is going to be a little bit lower, right?
Okay.
But if they are having a team take care of everything for you, it's going to increase the cost. So when I see somebody that's saying, hey, come get an implant for $1,000, should you need additional types of treatment to support that implant, it's going to be much more than that.
So other doctors are involved?
Other doctors are involved, definitely. In addition to that, the big lab bill, right? If you don't have an in-house lab, if you don't have all the equipment to take care of what you're doing with the implant, they have to send it out to somebody else. And that somebody else is going to get their cut. So those things also add.
So you have your own lab that, I think you said you print teeth.
So I print teeth, correct. Yeah.
So you make it right there?
So I make them right there.
Okay.
Absolutely. Okay. Yeah. So I keep everything in-house. What I like to do is I like to take care of everything that I can, right? And that's most everything that you're going to need.
Okay.
And so by doing that, I keep costs down. It's great. The other thing is insurance coverage, right? Dental insurance, I don't even like to call dental insurance like the way that we think about it with car insurance or health insurance.
Okay.
And that's because it does not provide as much coverage as those other types of insurance. So the maximum benefit that you're going to receive from dental insurance is usually anywhere from $1,200, maybe $1,500 to like $2,000 for a really good plan.
Per year?
Per year.
Okay.
That means you walk through the door in January and you can maybe do 1 crown. You can maybe do 1 root canal. You can maybe do 2 or 3 fillings. You can't do anything else. Dental insurance for somebody that really needs good treatment is really inadequate as far as that goes. All right. In addition to that, things like Medicaid, Medicare, I'd love to take care of people that have those plans, but I just can't do it.
Doesn't really cover it.
It doesn't cover it. In addition to that, those people that do cover it are, the state says who you can go be treated by and who you can't.
Okay.
And so that makes it a difficult situation for you to go to whoever can maybe even do the best job for you.
But you say about 8 out of 10 patients finance this.
Correct. Yes.
Absolutely. You have lenders and you also have payment plans in-house.
Correct. Yeah, we do both.
That's nice.
So we know that insurance is kind of something that isn't going to cover the amount of treatment that most people need. And so what we do is we help people break that down into monthly payments through either third-party lenders, or we do it in-house for them when we can.
So what else affects the cost?
In addition to that, like warranty and maintenance, right? If I saw an ad that somebody was going to do an implant for me for $1,000, I know that they're just going to place it. But if there's anything that goes wrong with it, do you think they're going to cover that? Okay. They'd be losing money on that, right? When you come to me, I warranty the implant, right? It's going to be a successful treatment, and if it's not, I'm going to do whatever needs to be done to make it successful for you. And we're going to talk about that all up front, and you're going to see that I follow through with it at the end. In addition to that, like snap in and snap out teeth, I provide that too. Sometimes that is more appropriate for people.
So a lot less expensive. Like a snap in, snap out. Okay.
So it is. It's less expensive. So it's not. It's it's a really good option for a lot of people. And the benefit that I offer that not a lot of other people offer is the ability to still do that all in one day. That means that listen, if you go to anyone else and you're going to do a snap-in denture, what's going to happen is they're going to do the surgery of removing the teeth, and then they're going to let you heal. And then they're going to come back and they're going to place the implants, and then they're going to let you heal. And then after the implants have healed for a little while, they're going to come back and uncover the tissue over those, and then they're going to hook up the denture to it and make it so it can snap in and snap out. I have found in my practice that we can skip all those steps. And as soon as we take out the teeth and place the implants, we can also snap in that lower denture, and that it functions.
And this is because of your advanced training in implant dentistry.
And yeah, this is something that I've been trained on, something that they do overseas regularly. I don't know why dentists don't do this, especially in the United States, when it's so successful and there's so much literature to support it, doing it this way. Another thing that affects the cost of things is the type of material you use, right? So the better the material, the more it's going to cost. And if you're going to pay for something that isn't the best material, it's probably going to wear out on you faster. You're going to have to repay for it later, right? What we do is we use the best materials. If it's acrylic that needs to be used, we're going to use acrylic, but we're going to use the best acrylic.
All right.
If it is something that we can 3D print for you, we're going to 3D print it with the best materials that I can buy.
All right.
And then when we talk about like the fixed teeth, for example,
teeth that don't come out, we're talking about.
Teeth, yeah, the teeth that don't come out. I'm using zirconia because right now zirconia is the best material for those types of teeth.
And experience plays a role?
Experience always plays a role, right? So
getting it done right the first time?
Yeah.
Hopefully.
Somebody says, I heard once a quote anecdotally that says, pay the right price and cry for it first rather than have to pay for it again and cry about it later, right? If you just do it right the first time, that's when you're going to get the best results. That's when you're going to spend less time in the dental chair, which
but
nobody
you're about
wants to
half
do.
off the big guys. Is that okay? Is that fair to say? For a full arch of teeth, you're about half off the national average. Is that true?
It in a lot of situations it is true.
Okay.
And the reason is because I'm not in a center with a whole bunch of different doctors that are doing this, relying on each other to do it, right? So we have a lot of people, and but in my clinic we don't. I take care of everything, so I can reduce my costs. I can make it lower for everybody.